9amHealth is cardiometabolic virtual clinic. Think of it as like the one place you ever need if you have a chronic condition, prediabetes, diabetes, hypertension, hyperlipidemia, and obesity. We do everything you need there. We are your doctor, and we have all the specialists on board and every provider around it. We take care of the medications that they get delivered to your door. We take care of the labs. We actually go into the home, draw your blood. We take care of the devices. They're all connected. We brought it all together and made it incredibly easy.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with my friend here, Anton Kittelberger, the CEO, co-CEO and co-founder at 9amHealth. Anton, great to see you.
Great to see you, and thank you for having me.
You know, maybe I'll just start there, because I said co-CEO and co-founder. Our audience is filled with a lot of startup founders, and so they might be curious to know that you have 4 co-founders and multiple co-CEOs, a highly collaborative team, and you've worked together in the past. So just start there. Talk to me about how your team came together.
Yeah, no, happy to. It all started really in 2012 when we built a company called My Sugar, which turned out to be one of the most successful self-diabetes management apps. And it was acquired by Roche in 2017 for around about 100 million. And all of the people that created 9amHealth now were already part of that journey.
Got it.
You know, Frank was one of the founders. He was CEO and co-founder at the time. I came on shortly after that. Our CTO, Bernhard, he was also part of My Sugar from the get-go. And then a little bit later came Paul, our other co-founder, right at the acquisition. So we kind of worked together for over 10 years, 6 years. And so, a lot of trust, a lot of experience working together. We know, where everyone's good at, how they take and so on. And we're just all friends. So
You're all friends.
We really like working together. And I will say at My Sugar already, Frank and I, we kind of lived this co-CEO thing, which I know it's unique. And we had a lot of discussions about it when we started 9amHealth. But it's really how we lived at My Sugar already. We did this together most of the time, very collaboratively. We discuss a lot, and it can totally be that we fight, but then we will agree on something, and we go together. And I think this whole thing of having 4 co-founders, even 2 co-CEOs, leads to, I think, better decisions.
Okay.
It also leads to more motivation in the team, because you can't always be on top of your game, but hopefully your co-founder is at that time, and he can pick up and push you along the way. So I think that's just really key for us.
Yeah, I think to be a successful co-CEO, an interesting element to me is there's an element of humility that's involved, because to be the CEO is to say I'm the top dog, and to share that with somebody. And say, to share the honor of that even takes some humility, which I think, I don't know, is that reflected, do you feel like, in your team dynamic?
Yeah, absolutely. We're equal partners. Yeah, absolutely.
Yeah.
It actually goes beyond Frank and I. So it is actually Paul, Frank, and I who really closely align on the business. We all have our own responsibilities. We discuss a lot, and then we go with our joint decision. Okay. I think it's really one of our success stories, really, from My Sugar, how we led the team there. And here at 9amHealth, a lot of times when I look at even companies that I invested in, founder clashes are happening all the time. You go through difficult moments all the time. With a team like that, it's so much easier. If you're friends, if you trust each other, if you know you can go through anything together. The SVB crash, for example, that's just
you were in the middle of that.
We were in the middle of that, and we. I think we managed it really well, and that's really just because we are the team we are.
You make it sound simple to just be friends and have trust. It's a deep thing. So you sold My Sugar to Roche. You said $100 million. You could have maybe sailed off into the sunset or done something simpler, but you got back into the fray with 9amHealth. I'm sure it's stressful. There's a lot of work involved. Why get back into the game, and sort of what were the ingredients that came together to say now is the time for 9amHealth?
Yeah, I will say when you say there's a lot of stress and a lot of work involved, I think what's the most important thing in our lives is to work on something that we truly love, and we were just done with what we truly love, right? So we had to get back into it, and What we learned at My Sugar, treating over 5 million patients, is, in order to deliver these, sustainable clinical outcomes, you have to go to the prescription medications, you have to do the labs, you have to do the clinical work to really be with the patients, because that's kind of the base for everything. And then you can layer everything else that's around, basically digital health 1.0 on top of that. But you have to be deeply clinical. And that's what we learned there, and that's why we built 9amHealth. And 9amHealth is a cardiometabolic virtual clinic. Think of it as like, the one place you ever need if you have a chronic condition. And
Any chronic condition, or
well, we're
range.
focused right now.
A range.
Right now, we're focused on 5 chronic conditions.
Got it. Okay.
That's prediabetes, diabetes, hypertension, hyperlipidemia, and obesity.
Okay.
Basically, diabetes and obesity being kind of the main entry
Got it.
points for us, and we do everything you need there, right? So we are your doctor, and we have all the specialists on board and every provider around it. We take care of the medications that they get delivered to your door. We take care of the labs. We actually go into the home, draw your blood. We take care of the devices. They're all connected. So everything that's basically been roaming around the last couple of years, and I will say has made it sometimes even harder for us patients to navigate it. I say us patients because I live with a chronic condition myself with type 1 diabetes. We brought it all together and made it incredibly easy.
Okay.
And yeah.
Walk me through the patient experience. You say it's easy. Let's say I have type 1 diabetes. I'm on the platform. What are some of the interactions, the nudges, the experiences that I'm going to have throughout the day?
Yeah, sure. So we don't take care of type 1 diabetes yet, mostly.
Okay.
So it's
the chronic type 2. Okay.
Type 2, it's prediabetes, obesity. Those are the main conditions that we care for. We do care for a few type 1 diabetes patients, but that's exceptions. In essence, the customer journey starts with either a brief medical history, like a questionnaire that you'd answer, or we get to pull your medical history right out of the connected systems that we have. And so afterwards, our algorithm will basically look at everything we know about you and you told us about you and come up with the right treatment plan.
Got it.
Our clinical team will then work with that and basically confirm a few things with you. And then you're basically off to your perfect personalized treatment plan. Oftentimes that starts with labs if you have no recent labs, right? So a lab technician is going to come to your home, is going to draw your blood and bring it to a LabCorp request, and that gets processed there. We immediately get the results fed back in, and our clinical team will, based on these final data points that are coming in, then start to prescribe if appropriate. And that ranges from all the diabetes medications to the obesity medications to hypertension, hyperlipidemia medications, all of that, plus the lifestyle side of it, plus the respective devices that you need, from like a scale, a blood pressure cuff, or a glucose monitor, or CGMs. Whatever is the right path for you, we really look at members holistically. You'll get that prescribed, delivered to your door, and off you go. And not just once, but continuously.
Interesting. What I'm sort of seeing is this a wrap-up innovation where you're saying, what, there used to be a platform that could bring blood testing to your home. There used to be, pill pack coming to your house. Let's put it all in one place. And that leads me to think this is a, capital-intensive sort of concept. And you've got a team with the experience. You've raised funds before. You've exited a company before. You have the 4 co-CEOs. How big of a sort of distinguishing factor is your ability to raise?
Yeah, that's a good question. I think with any startup journey, the ability to raise money is incredibly important, right? It's our lifeblood, right? In the end. I think the time has changed a little bit, so that some of the elements that we have done now can be done very well through partners. You don't have to build everything yourself, so you don't necessarily have to have all the capital to, for example, run a whole lab technician network nationwide.
Phlebotomy,
Yeah, I mean, which is a lot of money that you need for that, and you need the scale also, right? So we partner there, for example. We are really focused on the technology on the clinical side of it, bringing all the data points together and just using all these elements of care, the medical history, the data points that are coming in daily, the lab values, all of that, and your recent interactions to continuously update that treatment plan and make it incredibly efficient for all our providers to work on top of their license.
Okay. Talk to us about your go-to-market. Who's your ideal partner? You could obviously work with a range of partners and directly to consumers.
Yeah. So our prime partners are pharmacy benefit managers.
Okay.
So in the end, we want to go to employers, right?
Okay.
But we do this through pharmacy benefit managers. We do it through aggregation partners and navigation partners. And then we basically go to the employer and become a health benefit in their offering.
Okay. Why the PBMs and employers versus going to a payer, hospital, community health, whatever? I mean, you could be useful in so many places.
Absolutely, we could, and I see all of them
Yeah.
in like the V2 of our company.
Okay,
Right? So
okay.
right now, the employers are really our number one because that's faster to market. We can reach bigger scale that way. And we are working on the health plans, we're working on health systems, but we see those more play out in like 2025, 2026.
Okay. When I think about employer benefits, I think about low adoption. I think about struggling for adoption. Great plan, give it to the employer, doesn't get utilized.
Yeah.
How are you addressing that issue?
Yeah, I think there is one key element that we're helping employers with today, which is the medication spend. That's
okay.
really how we get in the end, because you see all the GLP-1 craze out there. Everyone wants to be on a weight loss medication, and you need to manage that. So that's where we come in and manage that. We make it incredibly easy for our customers, members, to work with us, but we also manage that spend. So we make sure the right people get access to these medications. We try different things before because we basically have everything in our toolbox that is out there basically. GLP-1s are one part of the toolkit, but we also, we do from lifestyle modification all the way to bariatric surgery, whatever delivers the right ROI and is the best for the member. So that's really where we help the employer partners.
Okay.
And the employees, on the other hand, when you say like low adoption, the GLP-1s are a real driver to adoption.
Okay.
And this notion of getting access to a GLP-1 through that one service that your employer has partnered with in order to control the spend, but then also make sure these drugs are administered properly is a very appealing entry point.
Does that mean all the shifts with GLP-1s was a real shot in the arm for 9amHealth in terms of uptake and adoption?
Yeah, it gave us wings. I would
Okay,
say.
okay,
Yeah,
interesting.
yeah.
What are you most excited about over the next 12 months in terms of raises, milestones, partners?
Yeah, thank you for the question. I mean, we just closed the Series A extension.
Congratulations.
We brought the Cigna Ventures team on board. And
what was the amount?
9.5 million we
Okay.
raised. We extended our Series A, and yeah, it's just a real testament to the approach, to the solution. Also, hopefully over the next couple of months, you'll hear more about what we can do in the Cigna ecosystem. And so just really excited about having such an experienced investor and also access to some of their business lines.
Yeah,
Really
yeah,
excited
that's
about that.
one of those investors where it's as much about the access as the cash.
It is.
Isn't it?
Yeah,
Isn't it?
yeah.
What are you excited about those funds enabling you to do with the company?
Yeah, so we've signed a ton of contracts towards the end of last year, and this year is really all about execution and scaling up our team and really rolling out to all these members out there that are waiting for much easier healthcare going forward.
I love it. Anton, great to get the update. It's been exciting to watch 9amHealth grow, and just, your passion to come off of my sugar and say, we're not done yet. We're going to do this, and we're going to help millions more people. So thanks for the update, and I wish you the best in the next year.
Logan, thank you.
All right. Take care.